Hi, I'm Dr. John Harper from beautiful Oceanside, California, and I'm here with you today with another 2-minute thyroid tip. I just love the saying right behind us, what we know is a drop, what we don't know is an ocean. This was spoken by Sir Isaac Newton over 400 years ago. And you would think that here we are in 2016 and we would have figured everything out. Well, there's a lot of things that did get figured out, but there's a lot of things that didn't. And so what we ended up with is that we have this problem of thinking that, well, we're so smart that we know everything, and the things that we do, especially for our health, must be exactly what we need to do. Well, let me read this to you here. So this is from Dr. David Derry. He's a medical doctor and a PhD. He's a thyroid expert in research who's based in Victoria, British Columbia. And this is what he had to say about the TSH test. We are following a test which has no correlation with clinical presentation. It means doesn't match the patient's symptoms. The thyroidologists, these are the people who study or treat thyroid problems, by consensus have decided that this test is the most useful for following treatment when in fact it is unrelated to how the patient feels. The consequences of this have been horrendous, his words. 6 years after their consensus decision, chronic fatigue and fibromyalgia have started to appear as a diagnosis. But because their TSH was normal, they have not been treated. The TSH needs to be scrapped and medical students taught, again, how to clinically recognize low thyroid conditions. And I'm going to add to that, instead of just going by a stupid lab test. See, anybody can get a lab test and anybody can read a piece of paper that says low or high TSH, and then anybody can write on a piece of paper, here's some levothyroxine, take that. In a month we're going to test you again to see if we're being successful. I don't think that's the way to do it. What I think you need to do is instead is to, like this doctor recommends, scrap the TSH, get rid of it altogether, because it really does not tell us exactly what's going on, but really what does is getting to the underlying cause of the problem. And that's what I recommend. This is why I recommend you go to a functional neurologist like myself, functional medicine person like myself, to get to the underlying cause so you can find out what's wrong, get the right treatment, and therefore get a lot better. Take care. Have a great day.